Are you in pain? Yes. Well, then your sciatica may not be a disc problem. Your leg burns, your back feels blocked, the pain shoots down toward your buttock, the thigh, maybe even the calf, and immediately everyone says the same thing. It must be your disc. But what if the disc is not the real problem? What if your MRI shows something scary, but your pain is actually coming from something completely different? Well, this is one of the biggest misunderstandings about sciatica. Yes, a herniated disc can irritate a nerve. Yes, a compressed nerve root can create real leg pain. But not every pain going down the leg is caused by a disc. Sometimes the sciatic nerve is irritated by deep muscular tension. Sometimes the pelvis, sacroiliac region, hip muscles, or lumbar joints are driving the symptoms. Sometimes the nervous system becomes hypersensitive and the pain behaves like sciatica even when the disc is not the main culprit. And this is why two people can have almost the same MRI but completely different pain. One person has a disc herniation and no symptoms. Another has unbearable leg pain with only minor imaging findings. So the question is not only what does the MRI show? The real clinical question is what structure is actually generating your pain today? If your treatment is based only on the MRI, you may spend months treating the wrong problem. You may stretch aggressively when the nerve needs calming. You may strengthen when the system is still irritated. You may even panic about surgery when the main driver is functional, muscular, segmental, or neuroinflammatory. Sciatica is not just an image, it is a clinical pattern. It must be tested, examined, provoked, compared, and understood. So, if you have leg pain, do not ask only, is my disc damaged? Ask, is my disc really the reason I hurt? Because sometimes the most important finding is not on the scan, it is in the clinical examination. My name is Gerry Ivanov from the Science of Pain, and I would like to hear your part of the story. Were you told your sciatica was just a disc? Did the treatment actually help? Write your experience in the comments, because sometimes the real problem is not on the MRI.